So we are going to change, sort of change stations here a bit, and I want to introduce one of my partners here and one of the behind-the-scenes person who has worked hard to help make this happen, Miss Tiffany Devon, and she is the communications director for the Detroit Wayne Integrated Health Network. And I am going to slip off, and I'm going to hand it over to Tiffany. All righty. We do that warm handoff.
Like it. Thank you so much, Dr. Dudley. Wow, what an inspirational couple of days we've had, and we are just rocking and rolling right now. Daniel, I don't even know what to say. You are such an inspiration, and thank you for being with us. We're going to welcome you back for a panel discussion in a little while, but I do want to continue on the role that we're going. Again, my name is Tiffany Devon. I am the Director of Communications for the Detroit Wayne Integrated Health Network, and we are so excited that we are able to have these courageous conversations for the last 2 days. I've learned so much, and I know that we're making a difference, and I know we're going to continue to make a difference. So I'm going to serve as the moderator for the next panel. The next panel is called The Key to Prevention, a panel of experts. And our guest speakers are going to explore a number of different approaches to prevention, addressing unique ways to connect with individuals where they are, exploring the root of substance use disorder, and alternatives to addressing pain. We're also going to welcome Daniel back to learn more about the goals of his organization and, of course, ask him additional questions. I'm going to introduce each panelist before their presentation, and we will welcome each person one at a time to hear their perspective and their expertise. We will have the opportunity to have Q&A at the end of all the presentations, and feel free to ask your questions. We're going to try to get to as many of them as possible. So I want to give a shout out to Dr. Dudley, who has handled this conference for the last 2 days. She's absolutely an outstanding professional. She is going to be one of our panelists right now, and I just know that she is going to bring her unique perspective to all of us. She is the president and CEO of the Youth Connection. She has designed, developed, and implemented numerous programs that address the needs of children and their families. I know she has a passion. I know she's a very, very well-respected colleague. She's also the chair of the Love Detroit Prevention Coalition, where she works to reduce youth alcohol abuse, marijuana use, and the non-medical use of prescription drugs. Please welcome again Dr. Dudley, who's our first panelist.
Why, thank you so much, Tiffany. We've heard a lot over the course of yesterday and this morning, and I want to talk about, and Nikki asked me to talk about prevention, and I want to say prevention continues. Now, these are indeed challenging times in the midst of a COVID-19 pandemic and an escalating opioid epidemic. We do not have the luxury of scaling back on any of our efforts. But we heard yesterday from Mr. Jensen that about the gross disparity of funding for SUD services compared with mental health. And we would wager to guess that the comparison to physical health is even greater. He further shared that what we are witnessing with this COVID-19 pandemic is that 92.6% of behavioral health providers have had to decrease some of their operations, that only 37.9% of behavioral health providers can survive financially for the next 3 months. 31% of patients have been turned away, canceled, or rescheduled. Now, it would be easy to throw our hands up because we couldn't meet in person. We can lament because our structured group sessions and trainings cannot host more than 10 people. And in order to safely provide any services, we're looking for the resources to install sneeze guards in our offices and to buy face shields and hand sanitizers and other PPE equipment. Our funding to provide needed services are seeing cuts. All the while, our families, our constituents, our patients, and our youth are struggling. The sheriff yesterday shared that the rate of substance use is increasing with opioid use, misuse, and death scaling up. Our poor urban communities have been the hardest hit. These are the people many of us serve. We all know family members or friends and program participants who have contracted this COVID-19 disease. And we also know about those who have succumbed. We know firsthand the lack of resources our communities face to effectively address these concerns. But That is when our best prevention efforts have to take center stage. Innovative approaches such as those shared by Mr. Dewberry yesterday. If you are on this Zoom platform, you have already adjusted. I know many of you have gone from Zoom to GoToMeetings to Duo to Blue Jeans and have had to learn how to navigate between breakout rooms and use virtual whiteboards. This is only the beginning. Our prevention work has to move with the times and demonstrate the power of our ingenuity and tenacity to make a difference. Nikki asked me to share ways our prevention efforts at the Youth Connection have continued during this pandemic. The Youth Connection is a drug-free communities grantee, and we chair the Love Detroit Prevention Coalition in partnership with the Detroit Recovery Project. Our youth committee, if I have to say so myself, is absolutely awesome. Right before the shutdown, we had hired a dynamic young blood that I talked about last year as a community advocate, Sharice Johnson. During the pandemic, we did not want to lose the momentum that we had started. So our youth, with a little bit of encouragement from us by texting, calling, threatening, and promising, they responded to a call for presentations for the mid-year CATCA, Community Anti-Drug Coalitions of America Conference. Their presentation entitled Prevention Continues, Engaging Youth in Virtual Activities, and it was accepted. They received photo voice training by Adora Ezeki from the health department, one of our partners. They conducted drive-bys in their neighborhoods, taking pictures with their cell phones that represented how drugs impacted their communities. They conducted an environmental scan of their communities utilizing Google Earth, Google Streets, and Google Maps. And they took still shots of marijuana signage. They used the internet to research the marijuana signage guidelines for the state of Michigan and found that some signs needed to include information stating for youth by individuals 21 years of age and older, keep out of reach of children. It is illegal to drive a motor vehicle while under the influence of marijuana. National Poison Control Center number 1-800-222-2222. They found the signs in their neighborhoods did not contain this information. In their internet search, they also found that Councilman Benson was active regarding signage issues in Detroit, and he was their councilman. We set up a Zoom meeting with Councilman Benson, and they created an incredible presentation regarding marijuana and teen use and the signs not meeting state requirements. And then they finally asked him, "What are you going to do about it?" Councilman Benson indicated that he would reach out to the city law department and have them research and address this matter. The youth worked for weeks on their CATCA presentation. In their session, they highlighted their virtual work and efforts. 30 minutes before their session started, 2 of our youth lost internet access, and their parents threw them and their laptops in the car and drove them across town to their sister's home. My kids and their fearless leader were ready. They were scheduled for the last day of a 5-day conference for the last session of the day on a Zoom platform. 8 youth presented to over 250 participants to rave reviews, only losing 2 participants by the end of their Zoom session. Our kids also received the 2020 Youth United Advocacy Award. In the midst of a pandemic, they insisted that their voices be heard. So now we know prevention works. In our Health, Wellness, and Promotion Division, when we sent everyone home to work from home, my staff reached out and called every one of our Bodvin Life Skill families to check on them, connected them to resources, and shared fun facts like polar bears are left-handed. Why that's a fact you want to know? Now you know. For several months, they reached out to over 200 families. They sent them emails and text messages regarding resources and addressed any needs they or their children had. Over the summer, my assistant director, Deb O'Ra Mitchell, reached out to Iowa State University, and she and her staff worked with the developer of the Strengthening Families 10 to 14 program, Catherine Hockaday, and created the virtual Strengthening Families 10 to 14 program. The Youth Connection is the only program to date that has been certified by Iowa State University to conduct this program virtually and with fidelity. It was tremendous work. Staff dropped off packets to families every week. We arranged to have their dinners delivered by each family session. and we dropped off balloons and certificates and flowers for their graduation. But then it was a surprise at the talent that my staff had, that hidden talent, when they created a video, Adrima and Frederick, inviting parents to the Strengthening Families. So if I could have that video played real quick. What you have to do is to tap into those hidden resources right there in your own office. And we were excited. They put together some other videos as well. 3 of the parents in our Strengthening Families program is now part of our Love Detroit Prevention Coalition parent sector, with a husband and wife serving as co-chair. Prevention continues. We moved our Narcan training to a virtual platform and have scheduled monthly community Narcan trainings. Those that participate, we arrange drive-bys to distribute their Narcan kits into terror bags. Since September, we have trained over 900 individuals, including our youth, the nurses at Detroit Public Schools Community District, DPT officers, nursing schools, AARP, and many community members. Prevention does make a difference. It's up to us to persevere during these challenging times. It will be difficult, but as a nonprofit or a SUD provider, when has it not been difficult? Change, we have to do. Evolve, we must do. And challenge the status quo, that's what we're all about. So, many times people will tell us that it can't be done. So I just want to leave with you that somebody will say to us preventionists that it cannot be done. But we'll chuckle and we'll reply that maybe it can't, but we won't. We will be the ones that won't say until we try. Someone will scoff, "Oh, you'll never do that." At least no one has ever done it. But we'll start to sing, because we like to sing, and we'll tackle the thing that couldn't be done, and we'll do it. So, preventionists, SUD providers, all of us that are here today, rest if you must, but don't you quit. So Tiffany, I turn it back over to you.
Thank you so much. You are such an inspiration, and I love that video, and I want that video on our website right away. So we'll talk about that later. Thank you for your energy, and this panel is going to be incredibly exciting. I am going to welcome our next guest, who is the President of Clinical Research and Community Health at Sina Health, Dr. Khalil. He has conducted research at various institutions, including the Wayne State School of Medicine. He focuses in various areas such as gastrointestinal and ovarian cancer. He's accepted as a research fellow at Henry Ford Hospital in Detroit and is an adjunct faculty member of Baker College. Dr. Khalil has actively been involved with the Detroit Wayne Integrated Health Network SUD faith-based committees, and he has shared his expertise at various leadership and wellness conferences. Please welcome Dr. Khalil.
Thank you, Tiffany. It's good to see you after some time. Before I begin, أعوذ بالله من الشيطان الرجيم, بسم الله الرحمن الرحيم. We start in the name of God, the most beneficent, the most merciful. I'd like to thank everybody for allowing me to speak at this event. I think we're in a unique situation but every situation and every day we wake up, everything is unique. So we accept this uniqueness and we try to adjust the best that we can. I'm not one to hit the panic button, but last March, when this conversation of Corona started to begin in this questioning of lockdown, I saw a lot of individuals, including myself, start to panic. And I had a lot of questions. Are we allowed to go outside? Will we be allowed to go shopping? I had bought a second fridge because I thought I had to stock up on food. And oftentimes when it's an unknown catastrophe, we attempt to hit the panic button and sometimes make decisions or make wise decisions or make rash decisions. But oftentimes decisions are made. There are times when it's okay to pump the brakes a little bit, and take a step back. And when we take that step back, we should reassess ourselves. This has been a very detrimental time towards our population, specifically here within the United States, specifically here within the state of Michigan. I was alarmed at the fact that I think back in my heyday, I considered myself an athlete. But technically, if I could get a football and I could hit Windsor with it, that's how close they are to me. Their COVID rates are extremely low, why ours are extremely high. And we're just a river's throw away, which is a bit fascinating. But we have to reassess ourselves. I'm a part of a lot of advocacy boards and whatnot. And interestingly enough, towards the middle of the lockdown, we saw numbers decrease of our usage. A few of the courts that I'm a part of saw a lot of the drug-related cases come down. So I think that was a good thing. But how can we effectively deal with a pandemic within a pandemic? Because although Corona is going around, the opioid pandemic and epidemic never went away. And I think I'm going to share a few ideas with you, and I hope they do you some good. Before I'd also like to get into my talk, I'd actually like to thank Dewana Coates from Faith, Hope, and Love Outreach Center, who's done a fantastic job throughout this, providing care for her patients, oftentimes when it's emptying out her own bank account. But that's the type of commitment we need. How can we deal with this situation when we're dealing with opioids within a pandemic or epidemic within the pandemic? Oftentimes we need to understand that if we're youth or even if we're the adults, there is peer pressure still. And we need to know how to effectively deal with that peer pressure. If we feel that the environment that we are in is not healthy for us, we as human beings have the right to take a step back and state, this is not for me. Oftentimes being in certain circumstances, being around certain people will kind of lead us astray. When you see that happening, maybe it's time to pump the brakes and take a step back. But this may then associate with life pressure, because life pressure is real. It's a stressor, is it not? But oftentimes when people have a life stressor, they turn to substance abuse. And that makes things worse. So what can we do? Although the state is locked down or was locked down, although there was a pandemic, you still have the abilities to exercise within your home. I took an interesting poll, and the poll didn't go so well. When was the last time we read a book? Reading has come down. We are very dependent on our phones. I think subconsciously we've become addicted to the phone. And we've seen the rise of TikTok has always been around, but for some reason, the pandemic is going crazy right now. And we spend more time watching 10 to 15-second videos than we actually do educating ourselves. There are still opportunities to volunteer. There's numerous soup kitchens. Of course, they're properly social distance, but we still have a large homeless population that are in need of food and water and shelter. But in the middle of a pandemic, who's helped them? A lot of these institutions are relegated to using their own resources because they don't have the manpower. We can be that manpower. And being a part of anything positive or relaxing, I think that's very important. Find what you feel is positive. Find what you feel is relaxing and engage in those activities. It's very interesting. Before we would be, specifically me, I'd be too lazy to go to the doctor. I'd be too lazy to go see my therapist. I'd be too lazy to go see my psychiatrist. Now I'm a button's push away from clicking a Zoom meeting and I can engage with them there. Telehealth has been booming. Of course, statistics have shown our older populations have suffered a little bit because they are not as technologically savvy as our youth. But this gives us the opportunity to teach our fathers, teach our mothers, teach our grandparents how to use technology so they are able to access care. Now access to care is actually significantly a button's push away. And now we are able, initially I understand there was, as the research showed, that there were some issues with dealing with telepsychiatry, seeing somebody, the human-to-human interaction, but having a Zoom or a WebEx meeting is better than nothing. Having a well-lived, balanced life is also crucial. Once again, the integrity of exercising does not need to be confined to Planet Fitness or anything. You can still run, you can still walk, you can still do push-ups, you can still do sit-ups, you can still do your jumping jacks, all within the confines of your bedroom, your basement, in your front yard, in your backyard. Just because we are now maintaining our integrity of our safety within our households does not mean that our health should suffer. You know, oftentimes this is our opportunity as well to watch what we eat. Just because we're at home does not mean that we have to indulge ourselves and consume items that we wouldn't consume before. Sometimes when you're at home or at home for long periods of time, there's a propensity for you to get a bit lazy and for me to get a bit lazy. So what we do is we have a seafood diet. Whatever we see, we eat. And this is kind of contradictory to establishing a proper mental and psychological standard for yourself. So we should be careful. It's a great opportunity for us to diet. You know, we can still do some calisthenics. We can still do some yoga within our house. And these are things that are healthy for us that we should continue to do so. You know, and if all that fails, turn to the 3 F's. And the 3 F's are very simple. If you have a friend, reach out to a friend. If you have family members, reach out to family members. And if you have faith, turn to faith. You know, this is a great opportunity. I'm very anti-texting because I like the human-to-human interaction, even if it's a phone call. But how often do we text each other? How often do we actually pick up the phone and check on one another? I can always tell you via text that I'm doing okay, that everything's fine, everything's perfect. And I can send you 437 emojis or GIFs with smiley faces that may trick you into believing that everything's okay. But from my voice, from the sound of my voice, or even if you FaceTime me, maybe you could see some emotional distress that I'm going through. Maybe you're the one that I can talk it out with. These are ways that we can maintain that human-to-human interaction so we don't feel so isolated. And I think that's very crucial. Your stomach needs food and you need to eat. Your mind needs people. Your heart needs people. The exchanging of intellectual capacities, the exchanges of emotionalities, this is human nature. So let's be human. I understand that we're in 2020 and this year's had a virus and whatnot, but let's reboot ourselves for 2021. We do not always need to rely on texting one another. You will never know through text if I'm okay or not. And it's your duty as a human being to check on me. And it's my duty as a human being to check on you. You know, I have a few minutes left, and I encourage everybody who's going through an opioid-related issue or any type of addiction, be it substance use or alcohol or anything, reach out to people, talk to one another, love one another. What's ever happened to love? I think it's become a bit taboo, but we don't need to rely just on ourselves. There is help out there. You know, you'll realize everybody at the Detroit Wayne Integrated Health Network is going bald and going gray because their phone lines are busy. I think as institutions now, we need to take, we need to show some fortitude. I hope I don't get in trouble for this, but oftentimes when we're at conferences such as this, organizations come together and we high five each other and we hug each other and we love each other and we talk about the quote unquote work we do together. But beyond the conference or beyond a dinner, I'm sorry to say we're a bit selfish. There's a misnomer that lawyers are ambulance chasers. Oftentimes, nonprofit or profit organizations are grant chasers. If you have the financial capabilities to take care of 100 patients and you cannot handle that 101st patient, you don't have to take them. Send them to your brother or sister organizations where everybody is here to help. So we need to reassess our priorities as organizations. I say this to myself before I say it to anybody. And we need to be careful because this is not a financial incentive. This is human life. So billing is not a priority for me. The maintenance of my life, my loved ones, my kids, your kids is a priority for me. We don't necessarily just have to come to work or come to conferences to help one another or just for photo ops. As institutions, we owe it to those people, and we owe it to us, and we owe it to one another. If we enter this field, we have to do so with decency. We have to do it with integrity. That's a mandate. There's a term, nonprofit. There's a purpose behind it. There's a mission. There's a value system. Do we just write these value systems and mission statements, or do we fully abide by them? That's something that we have to acknowledge. And lastly, I'm begging myself and I'm begging everybody, diversify your boards. Take a look at your boards. The people are suffering. Your board should be representative of the people, because me, as a Pakistani American, my value system and my cultural system may differ from yours a little bit. But when I get sick, I'm sick just like you, and you're sick just like me. But I'll never understand your culture and your society if I don't have that knowledge. If I'm a part of a board, if you're a part of a board, we need to establish diversity, because I'm telling you this. Addiction does not affect only a certain grouping of people. In the 60s, 70s, and 80s, you all know what I'm talking about. We failed a large grouping of people and we mass incarcerated them. Let's not make that mistake again. People need our help. We are here to help selflessly. And that is our aim. That is our goal. And I think I'm up for time. I hope that you hold me accountable for whatever I say. If you see me, challenge me. Ask me, am I doing my job? Ask me, am I fulfilling my role? I am indebted to the people I serve because they allow me to serve them. So let's take that as a social responsibility. Let's get through this together. Let's get through this epidemic within a pandemic together. And as time shows, we get through everything together as we're united. I'm going to leave it at that. I hope I didn't take too much time. If anything I said insulted anybody, I apologize. If it woke you up, fantastic.
Oh, let's run a little disclaimer underneath your name.
I know, right?
Now. But I just want to say, you really energize and you're incredibly passionate. But what I tell my circle and my friends is we're all going through trauma right now. We're all suffering, everybody. We've never been through this before. And we need to show each other grace. That's like my word now is grace. Yep. I need to show myself grace. I need to stop being so hard on myself all the time. And I need to cut my kids some slack. We're all just really trying to cope. And if we see someone struggling, I totally agree with you. I like to pick up the phone. I like to get on Zoom and see your face. Yep. I'm so appreciative of you and everything that you bring to the table. Thanks for being with us. I'm gonna go on to our next panelist, but I look forward to more dialogue. I would like to now introduce our next guest. He is a youth counselor at Spectrum Human Services, Mr. Lawrence Kenyatta, and he's getting quite creative with his outreach, knowing that we cannot rely on normal means to reach people these days. And before we meet Mr. Kenyatta, let's take a look at a story that Channel 4 produced, highlighting some of the conversations that are being held in spaces that allow for open dialogue and how it can be used in prevention efforts.
Well, the barber shop is much more than a place to get haircuts. It's a safe place to discuss sports, politics, religion, love, and everything in between. But there are a few topics that often get overlooked. Larry Spruill talked to two men who are hoping to change that.
The owner here at Heavyweights Cuts Barbershop tells me that his shop is a safe place for anybody. And if you happen to get your hair cut at a barbershop, especially in the African American community, you already know that you can talk about anything. And one local organization is doing just that.
We need other conversations that spark our youth. So that's what we got to gear our conversation for, because that's our future. You want a little bit higher?
It's a conversation Dave Hardin Jr. with Heavyweights Cuts on Kercheval says he wants to pave the way to have. Hardin tells me his shop is a safe haven for people to have that real down-to-earth talk about various topics and current events.
I try to minimize the cussing. I cater towards the crowd that I have. So if it's young people, I put the rap on. If it's older people, I put the news on. You know what I mean? The conversation kind of goes between. If I got both, then I try to interact with everybody.
Hardin says in order to set the right tone and environment, he has rules everyone has to follow.
No drinking, no smoking, no gambling. You know, a lot of people might not like it, but if you don't like it, then you can move on. You know what I mean? That's business I really can do about. How you doing?
So I want to ask you, brothers.
Thursday, Lawrence Kenyatta, a peer recovery coach and motivational speaker with Detroit Wayne Integrated Health Network, held his barbershop talk at the shop discussing those sensitive topics.
Today we're basically talking about the coronavirus issue that's going on. We're talking about violence in the black community. A lot of these brothers that sit in these shops, they are very community minded. They come in, you got politicians that come in, you got people that's very plugged in and very concerned about our community because the conversation needs to be heard. You know, especially during this time right now.
Larry Spruill, Local 4.
Well, we thank you for that. That is an excellent story. And I know that there are so many hubs in the community like that we're really reaching out to. I know sometimes I might tell my hairstylist something I might not tell my friends. So I'm sure in the barber shop situation, it's the same. And Mr. Kenyatta, we're just so grateful for you for your prevention efforts and working with Detroit Wayne. I know you're quite popular in the community, and thanks for joining us today. Can you tell me more about your outreach programs and what you're doing to reach individuals? No audio? No audio? Okay. Do we want to open it up to panel discussion then? I think we're having some technical difficulties with Mr. Kenyatta right now. So what I'd like to do is open it up to our panelists. Let's take some questions and see if maybe we can go back to Mr. Kenyatta a little bit later. So one thing that I would like to ask is, and your mics are open, so anybody can answer this, is what prevention challenges do our youth face that are different from a year ago? And do any of you have suggestions on how organizations can face them? Dr. Dudley, yeah.
Suggestions, one part that I can answer is suggestions on how to get towards the youth. I think a lot of it has to do, like I said before, it's getting to them before they hit a certain point, because after a certain point, they already have their mind set. They're okay with the life they have. They're okay if they are vaping. They're okay if they are drinking every day. I mean, they got their life. They're doing okay. They're settled. They're cool. They don't care that they might not get this job because they're happy with going and working fast food or whatever, just smoking and drinking, and that's like their life. They're okay with that. So getting at influencers and getting when people are just getting out of middle school, or even I think 7th, 8th grade is a really, really big time where they're thinking about like that. It's a really big time where it's the make or break of whether they're going to become addicted to these things or they're going to live a different type of lifestyle, and encouraging a lifestyle that is away from substances and more towards working out and sports. And if they have a goal to work towards, that's like, if I vape, this can take that away. If I drink, then I'm not going to wake up in time for practice. Then that's the stuff that kind of, it helps me get through things like and stay away from substances. And I think that's the main thing that will help other people too, especially younger people.
Excellent. Dr. Dudley, did you want to say something?
I think that, the challenges that our youth are facing, many of our kids, Dr. Khalil said that they're home and they're not used to being home. They're not used to being confined. And I think even, you know, they want to get out, and sometimes they don't perceive that this pandemic is really dangerous. And so we've had kids who say, well, I just went to visit my friend, and I left that friend's house and visited another friend, but don't understand how that travel around the neighborhood and around friends can impact their families when they come home. So these are challenges, and I think we definitely have to be in a position to say, wait a minute, let's talk about how that can impact and how you can make a difference.
I'd like to add in a point. Is that me echoing? I'm sorry. I think parents play a role, and I think parents should parent. And what I mean by that is monitor your kids' phone time, monitor their activities. You need to be careful to what they're watching, when they're watching, and whom they're watching it with. The connectability is completely crazy. Before, if I wanted to call somebody overseas, I'd have to dial 011-944 and be charged $3 a minute from Ameritech. Now I'm a phone calls away, or I'm an Xbox game away from communicating with anybody anywhere on the world. And oftentimes when I deal with kids, they're so much smarter than me, it's not even funny. They are so much smart when it comes to technological capabilities and accessing and introducing themselves to one another. That's a good thing. But with that carries power, and with that carries a certain amount of dignity and respect. So be mindful of who and what your kids are watching and doing online. Be parents, be with your kids.
I agree. I think also to Daniel's point is we really need to get the younger kids. They're so influenced by older people. Detroit Wayne has an incredible program, reachusdetroit.org, and it's a phone line, a text line that young people who are struggling can access. And we have found that, of course, young people like to text more than they like to talk on the phone. However, we also try to reach out to social media influencers who would be able to target the younger people to let them know this is available. And I know that that is working because so many people are on social media right now because we're trying to stay safe and we're watching a lot of videos and things like that. So I think a call to action, like Dr. Dudley talks about a lot, is for us as providers to make sure that we are reaching all those target audiences, but also doing it in a fun way. We're doing videos, we're putting music behind it, we're trying to reach out to musicians that might have an influence with young people too. So I think that's all excellent information. I'm going to go on to my second question now. And this is directed to any of you. Where do you think organizations need help the most to gain some ground in terms of prevention efforts? Where do we need help the most?
Thinking of ways to influence older kids that are already made their minds on being okay with being addicted to things, and that's when it all starts. It's all freshman through senior year or 8th grade. So I think that's something that I've been trying to think of ways to get towards that pocket of people that I'm kind of stuck with how to influence them, because unless they're like a close friend or family, it's really hard to get through to anyone around me that's my age, telling them, hey, like you do realize what you're doing, right? It's like a lot of people just they don't care enough about their own health, or they just aren't thinking that far ahead, and they don't realize how much they have to lose.
I think the other issue, I think Daniel's absolutely right. We have to start even younger. I think he mentioned that earlier. Our 8th graders, the data that we're looking at is saying our 8th graders are smoking, or and they see. You mentioned earlier that the advertising says it's safe, and they believe that, and they're vaping. So part of that, and then engaging our parents. Dr. Khalil said, absolutely. How do we make sure that the parents are parenting and being those influencers that our kids really need?
So I suffer from a disease called recency bias. If something's recent, then I care. And I think healthcare institutions also suffer from this as well. We have the ability to know an issue's arising if we take a step back, reassess, and listen. Um, Vaping didn't come out of nowhere. The opioid use didn't come out of nowhere. It was happening, but it wasn't happening at the magnitude as it was happening. So let's be honest, we didn't care. Because why? For me, cancer is much more of a focus. Diabetes is much more of a focus. Heart disease is much more of a focus. So then when we got hit with these epidemics, then we're like, oh my God, let's start filing grants and let's start doing something about it. We need to be able to kind of sort of predict the future, because every type of epidemic or pandemic that has arisen that is related to our health, we see it growing, and we need to nip it in the bud before it starts to peak. And that's what we always fail at. That's what I always fail at. So I think suffering from recency bias has caused a certain level of discontent amongst our population because we don't do anything until the problem is full-fledged.
I agree. But are we doing enough? Are we doing enough? What more can we do? I mean, we talk about funding. We talk about help from other organizations. In this COVID environment, it is difficult to raise funds for nonprofits, for organizations. Are there other countries that maybe are doing it better or differently that we can look at? Do any of you have any kind of a reaction to that?
I'm going to jump in on that one. Cuba's, we placed an embargo on them in 1957, but I was there last year assessing their health system. They are so far and away beyond us. It may be a third world country, but because of that embargo, with the lack of technology, they started to make their population healthy. They started truly incorporating community medicine. That there's a physician or physicians that'll know everything about you, your mother, your father, your kids, your grandparents, and they'll prevent disease. And I think this mantra is something, we are so predictable in how we provide care. We are so predictable. If I have high cholesterol, I'm going on a statin. If I have high blood pressure, I'm going on blood pressure medication. If I have whatever disorder, I'm jumping to some sort of therapeutic before I jump to the organic carrot juice man. When we take a proper holistic community health approach and we study our genetic makeup, we literally can prevent disease. We just choose not to because we want the quick fix, and big pharma is stronger than you and us for both.
I want to jump in on exactly what he's talking about, because if we begin to focus on a lot of this pandemic was due to greed, was due to those people who really felt they took an oath to do no harm, but they then decided, hey, that money was more important than that. And so one of the things I think we have to do is, how do we challenge that? Big Pharma, just went under with the opioid pandemic. They filed for bankruptcy, paid a couple $2 billion, but then are off somewhere else doing the same kinds of things. And so the doctors holding everyone accountable to making sure that the community is served versus whether the pockets are lined.
And I think that looking at the body, as you said, holistically. Okay, something might be going on. Maybe I don't understand how to do my checkbook. And that's stressing me out, and that's making me want to use a substance or whatever. And I know that all of our SUD partners are always looking at ways to help people holistically with an integrative approach, but I think that we definitely can do more. When I was in high school, I didn't learn how to put a checkbook entry in. I didn't know how to handle my finances. Why shouldn't that also be something that we as partners look at? Okay, I can help you with your mental health, but I have somebody who is a provider that can help you with, some basic financial thing. I mean, that's a real big key is, finances stress all of us out at some point. And so I think the integrative healthcare approach is a way to go. And making sure that we are looking at the person. All right, this person is struggling. What about the family dynamic? What's going on in the family? What's going on with mom and dad? And, you know, it's an entire body, if you will. And I think we all are on the same page, but I think we can all look at different ways and share best practices so that we can make sure that we're helping people, you know, in the communities in which we live and work. Daniel, go ahead.
I'm sorry. You raise an interesting point about family members, because when you're taking care of somebody, no matter what the disorders, caregiver burden is real. The stress placed upon family members is legitimate, but we overlook that as a community or as a society because we always focus on the person that is quote unquote diseased. But we also should recognize that when you're taking care of somebody, you yourself are going through your own mental health related conditions and issues based upon taking care of that. So caregiver, that's a great point, Tiffany. Caregiver burden is extremely real.
Thank you. Yeah. I live next to a woman who is very elderly, and I see her direct care staff come every single day at the same time. And I'm going to go over there and make a meal for her because I know how stressful that is. She's there 7 days a week, and I'm thinking, when is she taking a break for herself? You know, that's a real thing that we also have to really, really take into consideration. Daniel, when you were doing your presentation, there was a question that came in that I do want to address, and I would encourage anybody who has any questions, please put them in the chat. We're here for you, and we want to answer your questions. But somebody asked, Daniel, you coming from a little bit more of an affluent community, how are you bringing your message to people that may be in maybe a lower income area? How are you bringing that message to them where sometimes it seems like a lot of things are targeted to lower income areas that may not be healthy for you? So do you have a strategy or, you know, any kind of a plan as to get into some of those different communities?
So not specifically lower income, but what we were doing before everything started, like right now, it's pretty much on hold because of COVID. We had to think of a whole new strategy because we had this whole strategy, and then COVID happened, and we couldn't even do that at all. So it was basically we'd get messages on our website. Anyone could message us, parents, teachers, basically any adult that wanted to message, and they could say, hey, there's a big issue with it here. And we'd love to have some resources. We'd love to have a speaker come out. So we were planning to have, I think, over 200 schools. We were going to have a speaker, or at some point during the school year that we're in now, we are going to have speakers and all this. But now we're focusing on creating a virtual kind of presentation that can just be distributed, because we're not going to be able to have like me go around the schools physically, or anyone go around physically to schools, because schools aren't even open. Some of them are, but most of them aren't. So we're going to make, can you guys still hear me? Did I cut out for a second?
Yeah, it's going in and out, but it's okay now.
Okay. Yeah, so we're working on creating a virtual sort of just a like PowerPoint presentation, basically a whole like 20-minute thing that's like not just a video, but like video resources, like guide for whoever's reading it out to follow, if it's like a teacher that wants to make their own video and share it with their classes, so that we make it widely available for basically anyone to use. And we'll just spread that around to whoever needs it, basically. So it would include lower income. It's not necessarily focused towards anyone like that, because we just started. So we're not even focusing towards any group in specific. We're just making something that we can get out there. Because of COVID, there's really no other choice other than to do virtual. So, yeah.
Wonderful. I'm going to bring Mr. Kenyatta back, and you look good. So hopefully we can hear you and see you very well, sir. Good morning. How are you?
Good morning. Hi, everybody. Could you hear me now?
Yes. Yes.
Thank you. Thank you. First
Tell us
of all, I want to say it's good seeing everybody. This has been a dynamic summit. I'm getting so much out of it. Great speakers, good presenters. So I'm honored to be a part of it. And I want to thank you for giving me an opportunity, and this committee giving me an opportunity to come on and share. I had the honor for the past 2 months. I've been doing barbershop presentations pertaining to uh, opioids and doing the Narcan training kits. I'm happy to say for the past 2 months, I have been I have trained 84 barbers in the Detroit area and gave out 84 kits. And every time I go into the barber shops and do a presentation, the barbers and the customers are so attentive. So I want to thank the Detroit Wayne Integrated Health Network for giving me the opportunity, giving me the Narcan kits to go out and train. And Dr. Dudley asked earlier, she asked the question, what, how are we getting the community involved as far as prevention and recovery and treatment efforts? I'm proud to say for the past 10 years, this make my 10th year doing this, I've been going into the barbershops, I've been talking to the brothers, I've been talking to the customers, I've been passing out information and brochures and pamphlets and talking to people. Because when you're going into the barbershops, it's been my experience, you get a cross section of people in our society. You get the college educated, you get the high school dropouts, you get all in the barbershop at the same time. You get a cross section of the community. Historically, the black barbershop have been called the black man social club, because the black barbershop in our community got so much rich history. Even back in the 1950s and 60s, a lot of the civil rights leaders and activities came out of the barbershop and the black churches. So when you want to reach that African American community, especially when you're talking about working with men, then you have to go into the barbershops. You got to establish a relationship with them. So I'm proud to say, over my 10 years of working with it, when you seen that piece that was ran at the Heavyweight Barbershop with the brother by the name of David, who was talking about the rules and the regulations, it wasn't always like that. And I'm going to say this very humbly. We worked with that, but he was basically one of the first persons I started coming into, doing presentations, talking with people, and getting to know people. And over the years, over the 10-year period, I met a lot of his customers. I seen fathers bring their sons in. I seen elected officials come. That's a very popular barbershop on the east side of Detroit because of the atmosphere that's been created, that you can bring your family in and you can bring your son in, and it's not no cursing and it's not no drinking going on. So when we go into them barbershops, and like I say, for the past 10 years, I've been going in there, I've been establishing relationships with barbers and customers and giving them training. So when I went in there and I had the opportunity to do the Narcan training, the first thing that I realized I had to do in mostly every barbershop that I went into, I had to break the stereotype when it came to opioid overdoses. A lot of people, a lot of the customers, even a lot of the barbers would think when I was talking about an opioid overdose, the first thing they would envision was that image of that 1970, 1960 quote, junkie or addict who comes into your place and started nodding and just kind of like have that bad reputation in the community. So what I had to let them know that the opioids is a painkiller. Number one issue when it comes to the pain is the back pain. And I said, look, everybody in this barbershop can probably have back pain in their life, and you have to go to your doctor and get medication. And a lot of times they give you opioids. Then the second thing I tell them is pertaining to headaches. I asked the question, how many of you guys in there, and sometimes it be some women in there, how many of you guys had headaches before and you had to go to the doctor and get medication? That's opioid. Then we also talked about the psychogenics. When we talk about stress, when we talk about uh, uh, mental health issues, when we talk about depression, look, 70% of adults in America say 70% say they have psychogenic issues as far as during the course of the day, especially during this time. And I heard speakers before me and throughout this summit talk about the coronavirus. We're going through some hard times right now, and a lot of people is turning to medication. They turning to drugs. They turning to alcohol. They turning to a lot of mood-altering chemicals because they lost their job and because they lost positions and family members, and they got family members probably in the nursing home and the hospital right now. They can't go visit. So it's some hard times going on right now, and a lot of people is dealing with it. So I come into the barber shops and I talk to the brothers and the sisters in there, and we work with the barbers, and we got the directories to every drug treatment program throughout Wayne County that Detroit Wayne Integrated Health Network provides. We give them the information. We talk to people. We say, look, I tell the barbers, if you have someone that come in your chair to say, look, I'm depressed, I feel bad, I lost my job, issues going on, we give them the 1-800 number. We got literature. If you notice during that film clip, you have literature. It ain't just Jet magazines anymore. It ain't all kind of sport magazines. Now they have opportunity to sit up and read some issues that's going on. They might have a family member, someone who's going through some trying time. Like I say, in the recovering community, they call this part of the year the big three: Thanksgiving, Christmas, New Year's. And then add the coronavirus to it. More people is dealing with issues because they're waiting for a stimulus check. So as a prevention person, as someone working in the field, as someone who's committed to this thing called prevention, treatment, and recovery, I feel as though, to answer Dr. Dudley's question, what could we do if we get these barbers? Because a lot of these guys, when I talk to them, they don't go to the therapist. Some of them have this stigma, especially the older gentlemen I talk to. They're not going to go and see no mental health therapist. They're not going to go and sit down in my chair at the office and want to have this conversation with me. But if we could get them in a barbershop atmosphere, in the atmosphere where they're comfortable at, where they've been going for years, where they know people and they associated with them, then we'll have this conversation and we can talk, and then we can encourage them. Hey, look here, John, you need to call this number right here and we can work with you. I'm willing to bet you that 25% of the clients that I do substance abuse treatment with, they come from me directly from the relationship that I have with the barbers. They call me. I got a guy right now in my chair. You need to come and talk to this guy, or I'm going to get him this number, and we'll do the follow-up right there. So that comes from the 10-year relationship that I have established with the barbers, and I'm proud to say that I want to continue to work because that's a very important piece of working with the community and getting it out. Like I said, we got history with barbers. A lot of these guys, they bring their sons. I mean their sons now. Some of them bringing their grandkids. Some of these guys been coming to these barbershops since my presentation's going on. So they expect to see me at certain times a year. They expect to hear me when some issues going on about prevention. When we talk about fentanyl, when we talk about opioids, when we talk about marijuana legalization, when we talk about recreational issues. We also even go to the point where we talk about fatherhood issues. I spent one summer just talking about men's health and why it's important for men to go get checkup and men to go and take care of themselves and men to, because I come from a holistic perspective. I believe in working with the body, the mind, and the spirit. So I come from a holistic perspective. And when I'm in the barbershops, we're covered a holistic perspective. And I just want to say I'm proud to be a part of this panel. I'm proud of being a part of the prevention, treatment, and recovery community. You know, every opportunity I have, I network. I love what the mission.
Well, we can tell that he's definitely passionate, and we all share your passion, Mr. Kenyatta. Thank you so much for that. Unfortunately, we have to wrap this up. I could talk about this all day, but I am just so grateful for everyone for taking the time to be involved in this panel. You've all added perspective and shared some incredible information. I appreciate that so much. These 2 days are being recorded, so you will have a chance to look back on all the sessions. I would love to encourage you now we're going to take a 15-minute break. I would love to encourage you now to go into the vendor booths. We have some incredible sponsors who have resources and all kinds of information available for you. All you have to do is hit the button. Some of them have live people in there. Some of them have videos rolling. So please take a couple minutes, grab a drink, get back into the vendor booths, check out what we have, and we will be back here at 10:30. Thank you.